Hello friends, in this session we are going to study projective techniques Rorschach. So the objective of studying this module are to know the meaning of projective techniques and to learn about the use of Rorschach ink blot test. Projective techniques. These techniques are assumed to reveal those central aspects of personality that lie in the unconscious mind of an individual. Unconscious motivations, hidden desires, inner fears and complexes are presumed to be elicited by their unstructured nature that affect the participants' conscious behavior. Participants are shown ambiguous visual stimuli by the psychologist and are asked to tell what they see in that stimuli. It is presumed that the participant will project the unconscious concerns and fears onto the visual stimulus, and thus the psychologist can interpret the responses and understand the psychodynamic underlying the problem of the participant. Tests that utilize this method are called projective tests. These tests, beside their functions of exploring one's personality, also serve as a diagnostic tool to uncover the hidden personality issues. The history of projective techniques began in the beginning of the 15th century when Leonardo da Vinci selected pupils on the basis of their attempt to find shape and patterns in ambiguous forms. Projective techniques are an effective tool to reveal the latent or hidden aspects of personality that remain embedded in the unconscious until uncovered. These techniques are based on the assumption that if the stimulus structure is weak in the nature, it allows the individual to project his or her feelings, desires, and needs that are further interpreted by the experts. Projective tests. Projective tests were originally based on the particular theory called projective hypothesis of how to see into someone's mind. This theory is if somebody is asked to describe or interpret a meaningless ambiguous stimulus such as an ink blot, her answer cannot come from the stimulus itself because the stimulus actually does not look like or mean anything. The answer must instead come from to be a projection of her needs, feelings, experiences, thought processes and other hidden aspects of the mind. The answer may even reveal something that person does not know about herself or himself. This is the theory behind the famous Rorschach ink blot test. The Rorschach ink blot test. Rorschach ink blot test was developed in 1921 by Swiss psychiatrist Hermann Rorschach. In an effort to reduce the time required in psychiatric diagnosis, he dropped blots of India ink onto note cards, folded the cards in half and then unfolded them. The result was a set of complicated looking blots. Over the year, unaccounted psychiatrists and clinical psychologists have shown these blots to their clients and asked what they saw. His tests consist of 10 cards. This figure shows the most popular responses given by many participants on the Rorschach cards, such as in card 1, popular responses given were bat, butterfly, moth. For card 2, the popular responses were given to be 2 humans, 4-legged animals, dog, elephant or bear. For card 3, the popular responses included 2 humans, human figures. For card 4, the popular responses included animal hide, skin and rug. For card 5, the popular responses included bat, butterfly or moth. For card 6, the popular responses included animal hide, skin and rug. For card 7, the popular responses included human heads or faces. For card 8, the popular responses were animal, not cat or dog but 4-legged animals. For card 9, the popular responses included human. And for card 10, the popular responses included crab, lobsters, spider, rabbit head, caterpillars, worms and snakes. The test is administered by showing the participants the 10 blots one at a time. The participant's task is to describe what he sees in the blots or what they remind him of. In the test, the participants are asked to simply state whatever each ink blot looks like to them. Responses are scored by the psychologist using predetermined categories on key factors such as color and shape, movement, whether the whole or part blot has been seen, and whether the responses is given in content to the whole or the peculiar details in the blot. Of course, the only literal correct answer is an ink blot, but that is not considered a cooperative response. Instead, the examiner is interested in whether the participant will report seeing a cloud, a devil, her or his father, or whatever. This interpretation illustrates how whatever the client sees, precisely because it is not actually on the card, may reveal something about the content of his or her mind. It also illustrates that the thoughts revealed by the ink blot responses might not necessarily be deep, hidden, or mysterious. These blots are frequently used for personality description, diagnosis of mental disorders, and for behavior predictions. The whole procedure of the Rorschach test is a combined set of three components: vis-a-vis, performance proper, inquiry, and scoring. Let us deal with each of these one by one. Administration of Rorschach test. The Rorschach test is appropriate for participants from the age of 5 to adulthood. The administrator and participant typically sit next to each other at the table, side by side. Seating of the examiner and the participant used to reduce any effect of inadvertent cues from the examiner to the participant. This is to facilitate a relaxed but controlled atmosphere. There are 10 official ink blots, each printed on a separate white card, approximately 18 by 24 cm in size. Each of these blots have near perfect bilateral symmetry. 5 ink blots are of black ink, 2 are of black and red ink, and 3 are multicolored on white background. After the test subjects has seen and responded to all the ink blots, that is free association phase, the administrator then presents them again one at a time in a set of sequence for the participant to study. The participant is asked to note where they see what they originally saw and what makes it look like that is the inquiry phase. The participant is usually asked to hold the cards and may rotate them. Whether the cards are rotated and other related factors such as whether permission to rotate them is asked, this may expose personality traits and normally contributes to the assessment. As the participants examining the ink blots, the psychologist writes down everything the participant says or does, no matter how trivial it is. Analysis of responses is recorded by the test administrator using a tabulation and scoring sheet, and if required, a separate location chart. Administration of the test to a group of participants by means of projected images has also occasionally been performed, but mainly for research rather than diagnostic purposes. The administration of the Rorschach test can be put up to be in 2 stages, such as A. Performance proper. The examinee is asked to get seated and rapport is established with him or her. First, plate is then handed to the client with the question, "What do you think this could be?" During the process, the examinee needs to be careful about the following things: reaction time, which means the time gap between the card's presentation and participant's response. Exclamation and comments are excluded from scoring. The position of the card is also taken account of while participant is responding and are scored as low, up, left or right depending on the direction in which the card is turned. The responses are recorded verbatim for the reasons that the examiner can read it and analyze the same effectively. The total time for which the card is kept by the participant is also recorded. The time lapsed between the presentation of the card and the first response the participant gives is called the reaction time. On completion of the first plate, the second plate is given to the participant, and similarly all the 10 plates are presented in a sequential manner. The total number of responses is also termed as response productivity ratio and is coded as capital R. On a Rorschach protocol, for most adults the score varies from 15 to 30. Vague and uncertain responses by the participant is noted down to be clarified in the second stage of administration, that is the inquiry stage. B. Inquiry stage. It is the second stage of administration of the Rorschach test. It is taken up after obtaining responses on all the 10 cards during performance proper. The basic purpose of conducting inquiry is to collect all the necessary information for the accurate scoring of the responses. Here, a location sheet is presented before the participant and he is asked to locate the part on the basis of which he has responded, so as to maintain a permanent record of the area of the blot used by the participant in responding. The questions framed for the inquiry stage are based on the examiner's skill and expertise. Scoring of Rorschach test. While developing this technique, Rorschach experimented with a large number of ink blots which were administered to different psychiatric groups. On the basis of such clinical observations, various psychiatric syndromes that differentiate response characteristics were taken up in the scoring system. There is a focus of concern for Rorschach interpretation based either on the content of the response or on their formal characteristics such as location, determinants, form quality, and the various quantitative summaries derived from the responses, that is, the content. Scoring of location is important. Location refers to that part of the plot with which each response of the participant is associated. For example, whether the whole blot or a common detail or a usual detail has been used by the participant and are scored as capital W, capital D, small d, small d, etc. The determinants of the response includes form, color shading and movement and are coded as capital F, capital C, capital S, capital M, etc. The participant's perception of the blot as a moving object is scored in context of movement. The various types of movement include human movement, animal movement, etc. The form quality of responses may depict the precision with which the response matched the location used to their originality. The treatment of content also varies from one Rorschach system to another, except some major regularly employed categories. Some of the main categories are human figures, human details, animal details, etc., and are coded as capital H, capital A, capital H small d, capital A small d, etc. Some other broad scoring categories may include art, objects, plants, maps, landscapes, clothing, etc. For each of the 10 cards, certain specific responses are scored as popular because of their common occurrence and thus constitute the popularity score. This figure shows the types of Rorschach ink blot test scoring, that is location. Under location, whole, common details and unusual details are being studied. Under determinant, form, movement, color and shading are being scored. Form quality, under form quality, F plus or plus, F minus or minus are scored. Under content, human, animal and nature are being scored, and popular original images or responses are being scored separately. Example of Rorschach ink blot test scoring. Qualitative interpretation of the Rorschach scores include the association of whole responses with conceptual thinking. The color responses given by the participants are indicative of the participants' emotionality and fantasy life. The entire response for all the 10 cards, including the inquiry, are integrated together to interpret the psychodynamics underlying the problem and also decide upon diagnostic issues. Interpretation. The interpretation of a Rorschach record is a complex process. It requires a wealth of knowledge concerning personality dynamics generally as well as considerable experience with the Rorschach method specifically. Proficiency as a Rorschach administrator can be gained within a few months. However, even those who are able and qualified to become Rorschach interpreters usually remain in a learning stage for a number of years. The interpretation of the Rorschach test is not based primarily on the content of the response, that is what the individual sees in the ink blot. In fact, the content of the response are only a comparatively small portion of a broader cluster of variables that are used to interpret the Rorschach data. For instance, information is provided by the time taken before providing a response for a card can be taken significant. That is, taking a long time can indicate shock on the card, as well as by any comment the subject or the participant may make in addition to providing a direct response. In particular, information about determinants, the aspect of the ink blots that triggered the response such as form and color, and location, which details of the ink blot triggered the response, is often considered more important than the content, although there is contrasting evidence. Popularity and originality of a response can also be considered as basic dimensions in the analysis. Evaluating the Rorschach. Research with the Rorschach has proceeded in a number of directions. Many studies have compared psychiatric patients and other groups of special interest, such as delinquents, underachieving students, with ostensibly normal people. Some investigators have sought to derive indexes or predictions of future behavior from responses to ink blot and have checked, for example, to see if any anxiety and hostility are related to favorable or unfavorable response to psychotherapy. A sizable area of exploration concerns the effect of special condition, for example, experimentally induced anxiety or hostility, on the ink blot perceptions reported by the participant and the content of his or her speech. After a prolonged use of the Rorschach test as a psychometric instrument, some of the researchers found a number of difficulties inherent in this method itself, such as the variability in the total number of responses, examiner effect, and interdependence of scores, its reliability and validity, etc. The 5 major Rorschach systems in use developed in the United States show vast differences in which were documented by John Exner. He, with his extensive investigations of clinical use of the Rorschach test, came up with a single distilled system encompassing all the useful features being possessed by the method. All projective tests provide B data or the behavioral data. Examples of behavioral data are body language when interrogated, heart rate monitor, lie detector, communication pattern under stress, eye movement typing speed, and pressure facial responses to stimuli. They are specific, directly observed responses to particular stimuli, whether ink blot pictures or instructions to draw somebody. All the disadvantages of B data therefore applies to projective tests. For one thing, they are expensive and time consuming. For example, it takes around 45 minutes to administer a single Rorschach and another 1.5 to 2 hours to score it. The even more fundamental difficulty with projective test is that perhaps even more than other kinds of B data, a psychologist cannot be sure what they mean. What does it mean when somebody thinks an ink blot looks like a genitalia or imagines that an ambiguous picture portrays a murder? The answer and the validity of the answer depends critically on the test interpreter. Two different interpreters of the same response might come to different conclusions unless a standard scoring system is used. In this context, it is pertinent to mention here that the Rorschach ink blot test was never developed as a psychometric tool, rather it was developed as an instrument to aid in clinical diagnosis. One of the tests is the Rorschach, which according to one survey is used by 82% of clinical psychologists at least occasionally. It remains clinical psychology's 4th most used test and continues to be widely taught in clinical graduate programs. The Rorschach gets best result when it is scored according to one of the two specific techniques, either Exner's comprehensive system or Klopfer's technique. Research suggests that the Rorschach might be particularly valid for predicting certain outcomes such as suicide or commitment to a mental hospital. Understanding schizophrenia, a case study by Shobha Yadav. Schizophrenia is characterized mainly by the gross distortion of reality, withdrawal from social interaction, disorganization and fragmentation of perception, thoughts and emotions. Insight is an important concept in clinical psychiatry. A lack of insight is particularly common in schizophrenia patients. Previous studies reported that between 50 to 80% of patients with schizophrenia do not believe they have a disorder. By the help of psychological assessments such as Rorschach ink blot test, we can come to know an individual's problems, especially in cases where patient is less hesitant or has less insight into illness. Assessment is also important for the psychological management of the illness. Knowing the strength and weaknesses of that particular individual with psychological analysis tool can help to better plan for the treatment. The present study was designed to assess the cognitive functioning to elicit the severity of psychopathology, understanding diagnostic indicators, personality traits that make the individual vulnerable to the disorder, and interpersonal relationship in order to plan effective management. Summary of the lesson. From this module, we learned that projective tests are types of psychological tests that assesses a person's thinking patterns, observational abilities, feelings and attitudes on the basis of responses to ambiguous test materials. The Rorschach ink blot test was developed by Swiss psychiatrist Hermann Rorschach. It is a projective technique for psychiatric diagnosis. The test is administered by showing the subject the 10 blots one at a time, and the description given by the participant provides understanding of hidden aspects of their feelings, thoughts, personality, emotions that otherwise may not get deciphered from other forms of testing. Thank you.